Do you know anything about your pelvic floor? Because I thought I did. And no, I didn't. I didn't. Because today we are speaking with Kelly Peterson, who is a physical therapist. You might find her on social media under the Belly Whisperer. I cannot get over not only the information that she shares, but her enthusiasm, which is completely contagious. Now, she is a physical therapist that really focuses on pelvic health. So she is helping people, both men and women, that have postpartum, pregnancy, gut issues, painful sex, bloating, leaking, constipation, prostate issues. I mean, all of these different issues that come along with your pelvic wall. And again, I cannot even begin to tell you all the information that she just spilled on this podcast. So let's jump in. Ellie, I am been looking forward to this conversation since we booked it, because quite frankly, I feel as though this is a topic that a lot of people don't talk about, but they know about.
Yes. And it's not just women, it's men, it's everybody. I tell people that everybody has a pelvic floor. We all have the same parts. They're just organized differently. That's kind of how I explain it, because a lot of people think that pelvic floor therapy is just for women, right? Because of postpartum pregnancy. But in reality, a lot of men develop, prostate enlargement, prostate cancer, and they end up with, pelvic floor issues. And even when you're younger too. So I'm really excited to kind of share some information that is, to me, common knowledge and to help people out.
30 seconds in, I just learned something new. Oh
See?
my God. Yes. I didn't know that. Okay. So we're definitely going to dive into that as well, because I'm absolutely fascinated by it. And I'm a mother of 3 boys. It's always good to have this kind of information to pass on. But I want to dive in first to women. Like, when it comes to the pelvic floor, we hear about it all the time. We hear it from our doctors and all this other stuff that, you want to keep that strong, whatever. But let's talk about, what are the common problems that women have when it comes to problems with their pelvic floor? And what is a problem with, what exactly is that?
Yeah. And I think the biggest thing that I try to educate people on is, not everybody needs Kegels. Not everyone needs strength. And I think even doctors will tell patients, oh, you're leaking. Oh, you're having a little bit of urgency. You should do some Kegels. And they'll even tell them, buy the vaginal weights, buy those little weights you can insert. But in reality, a lot of people actually need lengthening or stretching instead of strengthening, especially younger women. And a lot of people that develop common issues that we treat are painful penetration, right? Pain with sex, painful urination, or then you have all the different types of incontinence, stress incontinence, urgency, fecal incontinence. So there are tons of different things. Other things that we treat too are nerve issues, right? Like common things, sciatica. People think, oh, sciatica is coming from the back. And sometimes it is. But also sciatica or radiating leg symptoms, pelvic floor symptoms can be coming from the nerves in the pelvic floor. So like pudendal neuralgia. So we actually treat, I think, a lot more.
We're definitely going to dive into. I've had sciatica since my son. I was pregnant with him.
Yes.
He was my last child, and I was in my late 30s, and he was huge. And one day, I used to jog during my pregnancy and all that stuff. All day, one day he shifted, and I lost control of my leg. Like literally, I wind up in the hospital at first, and they were like, we can do an MRI. And I'm like, are you going to be able to do anything about it? They're like, no, not until you're done with the pregnancy. I'm like, so you know what? Let's not bother. Yeah. But one of the things that they did come to realize that doesn't seem to be coming from my back. They think it's coming from my pelvis, but all right, I'm terrible. I never really
we even treat a lot of other things too, right? Like interstitial cystitis. Maybe some of your friends have IC. That's also what it's commonly called. It's like an inflammatory bladder, like painful bladder syndrome, or endometriosis. So many women are walking around undiagnosed with heavy, painful periods. And the sad thing is it really affects kids when they're younger, right? Like, how old were you when you got your period? And if you have endometriosis, you could be suffering, you're that kid that stays home for 1 week, when you're like 13, 14, and you're wondering, why can everybody else play soccer? How come they can put in a tampon? Why am I in so much pain? And, and sadly, sometimes doctors just don't even look for it. And then people feel like they're getting, gaslighted by doctors saying, oh, it's just women, they're being hysterical. And again, so there's endometriosis is one thing that we advocate for and we treat all the time. And it's not just, people think endometriosis just affects, the pelvic floor, but when you have endometriosis, you're having abnormal growth of the endometrial tissue in other parts of your body. So it grows in like your esophagus, your rectum, your stomach. And so basically every time you have your period, imagine not only getting inflammation in your uterus where most women do, but you're getting inflammation in your esophagus, in your rectum.
No.
Yes, it's and it's like you'll see photos online with like barbed wire around people's bellies and they'll say like endo belly. And that's what a lot of these patients, these women describe their pain as, barbed wire on the inside. And some of these women, if they have, there's different forms of it, the severe one, deep infiltrating endo, they have to have multiple surgeries to kind of excision or cut it out. And it comes back and comes back. So it's like it's a chronic, disorder, disease. So it's pretty amazing. And again, a lot of these doctors don't know about it and they'll just get sent to pelvic floor because, they don't know what to do with them. They're like, oh, they have this weird hip pain that won't go away with regular physical therapy. Let's send them to a pelvic floor therapist. And right away, I'll be doing my questions, asking about different things. And I'm thinking, I'll feel their belly too. You can even feel endo belly where it's a firmness. It has a feeling to it. So, and the sad part too, is that endometriosis can only be really the gold standard for diagnosis is laparoscopic or exploratory surgery. So a lot of insurances don't want to pay for it. A lot of doctors don't want to recommend it, or people are nervous about it. And that makes sense, right? So that's just one of the many pelvic floor disorders that we treat that's undertreated, in my opinion.
So let's be clear, because I want to make sure that one of the things that I always say is that just because it's like a lot of people have a common knowledge of what something is doesn't mean everybody knows what it is. So when we speak of the pelvic floor, what exactly is that?
I'm glad you asked because I got my model because I bring it everywhere with me. It's my best friend. So this is female anatomy. So I like to tell everybody, if everybody has those, gorgeous outer inner lips. And for some of us, right, our vulva, the external genitalia, some of us have longer outer lips. Some of us have longer inner lips, and that's okay. Everything is normal. But if you remove those, you have all of these beautiful muscles here. And people don't realize the pelvic floor, not to go into too much nerdy detail, has 5 main functions. And some of that is lymphatic drainage. Some of that is sphincteric, meaning you have to be able to have things close off. So you're continent, you don't, have any leaking. It has a sexual function, right? Arousal, orgasm. That's always fun to talk about. And then as well as support, right? I have, for instance, for female, you have a uterus, you have a bladder, and you have a rectum, right? And they're in that order. And your pelvic floor muscles need to be able to support that. What happens is if you get trauma, weakness, maybe pregnancy, you have a lot of weight gain, there's different reasons why, those may start to descend and come out of these openings. And that's what prolapse is. And a lot of women that, like, you've had 3 kids, a lot of women are walking around with like a grade 1, grade 2 prolapse, meaning that just grades how much it's descended. And you're completely, you're fine. You don't have any heaviness, leaking. But for some women, they feel that bulge. If they cough or if they push too hard because they're constipated, they can actually see their uterus or their bladder starting to come out. And then when it gets really bad, grade 4, it comes out. And then that's when women will say, I was sitting on the toilet and I was pushing. And the next thing you know, I had this smell and I looked and I felt this pop and I looked down and there's their bladder and some of them will go to the ER. I know.
Like literally, I did not know that was a thing.
Yeah. And it's not as common. Like a grade 4 that's again, worst case scenario. Most people have more of a grade 2, 3, but that's why I don't know if you have any friends that have had the mesh procedure, or maybe they'll say they've had a bladder lift.
I've heard of it. And there's some people that have their bladder or something removed, and that's gallbladder.
Yeah. Well, you can have a hysterectomy too. And there's different types. You can have a partial, you can have just 1 ovary, 2 ovaries. You can have a total hysterectomy and they can go in transvaginally through here. There's different types of surgeries for different things, but yeah, you can have procedures. And unfortunately, what I was saying about how we don't get enough people that are referred to pelvic floor therapy. We get patients that come to us post-surgery, and it's not even like they're post-op, like 6 to 8 weeks, like you would if you got your shoulder rotator cuff repaired or a total knee, they would send you and you would see a therapist right away. But for pelvic floor therapy, I'm getting these women that had the mesh procedure like 2-3 years ago, never had therapy after, and they've had all these issues. And now they were never taught how to stretch, how to breathe, how to strengthen. And now it's like, it's torn again. And now they had another surgery and it's torn again. And to me, you really want to have pelvic floor therapy before and after surgery or any procedure. And I say the same thing for pregnancy. A lot of people walk around with these fear avoidance because you hear all these, you hear, all right, social media, oh, don't lift weights if you're pregnant, you're going to cause a miscarriage. Oh, don't walk or exercise, that's going to cause a miscarriage. And people get scared, right? For a good reason. So, but it's a lot of misinformation when in reality, we know that exercise is great for getting blood flow to the fetus. It helps, right? And it helps not only to strengthen your pelvic floor, but your core, so you don't get a diastasis, or you help to lessen it. So again, there's so many topics we go about, but it's really important for people to realize that, prolapse, and that's another common thing that we treat, prolapse. And usually symptoms of prolapse are heaviness or a bulge in the vagina, leaking, pain with penetration. And sometimes even people's partners they'll feel it when they put their finger in there or when they're having sex. So it's pretty crazy, but what things can happen. But if you really learn about your pelvic floor and you actually kind of figure out, okay, are you somebody that has a weak pelvic floor? Are you somebody that has a tight pelvic floor? Or are you a mixture? Some of us, and some of us.
So how do you figure that out?
I know everyone always asks me, well, how do I know if I should Kegel? And I say, really, you either need to check with your finger. And I have a free video where I'm using a watermelon to demo what a Kegel is and how to grade it. But if you want, you can also just go and see a pelvic floor therapist. That's the best thing. I tell people you may only need one visit. And if you're somebody that is really fearful of having an internal exam, you're scared, you don't want that, that's okay. You don't have to have that. We can do everything external, because I get that question all the time. Oh, I'm nervous, I'm in my 70s or my 80s. And maybe, right, as you get older, you're going through perimenopause or menopause, your tissues are getting a little atrophied or the muscles are getting weaker. You get a little bit of thinning from lower estrogen. And so it can be more painful with penetration. So there's so many ways to help with that, and not just with medications, but with physical therapy. And so when we're looking, so when you look at this here too, you have to realize the pelvic floor, it is made up of 70% slow twitch muscle fibers and 30 fast, which means you should be able to quickly contract every second or be able to hold long duration. So what are the quick ones for? Coughing, sneezing, laughing, jumping, right? When you're on the trampoline. The long one is for when you're, going on a walk, right?
I mean, I'll be honest with you, as we get older, you're having more of the issues with the sneezing, coughing, and everything. And I don't know if that's from pregnancy or just getting older.
Exactly. And just in general, like from a physical therapy standpoint, I tell people all the time, as you age, your tissues are getting stiffer. You're getting more, gravity is, kind of a jerk, and it's working on it. So we're constantly getting pushed forward, right?
It's a jerk everywhere on the face, on the body.
Your skin. Yes, your tissues are, everything is, getting weaker. So I tell people, they'll say, oh, it's too late. I had my baby 20 years ago and I should have saw you, I wish you were around, 15 years ago or 10 years ago. And I always tell people it's never too late, because you're only aging. You're only going to get, unfortunately stiffer, weaker, muscles are going to get tighter, and you're going to need that in maintenance.
I mean, even when it comes to working out, and one of the things that they always say, as you get older, you should be building muscle. I mean, aside from the fact that it's good for your bones, good for your metabolism and everything like that, it's what keeps us functioning. I never really thought, admittedly, about pelvic floor. I think this is fascinating. So is it your opinion that every single I was going to say every female, but I guess it could be female and male, that regardless of whether or not they should have issues or whatever, there are certain things that they should be doing to maintain the health or the strength or whatever of their pelvic floor? Is that a thing?
Yes. I tell patients, so not to get too much on it, but I have a whole method, the Belly Whisperer Method online program designed for this, because it's something that I do every single day. And I've been doing it for a long time and not realizing that it's something that everybody should be doing, right? And one of the things I tell people, if you're going to do anything every single day, it's diaphragmatic breathing. Because when you use your diaphragm muscle, when you inhale and you take a breath in, right, your lungs will fill with air. The diaphragm will contract. The diaphragm muscle, it separates your chest cavity from your abdominal cavity, and it helps you with, inspiration, expiration. So when you inhale, it contracts and flattens. So I tell people, when you inhale, your pelvic floor will lengthen and stretch, especially if you know how to breathe downward, because a lot of us think this is breathing. Like I'll say, take a big breath in.
It's from the belly, right?
Yeah. But I'll say to you, go ahead and take a big breath in. And some people will go, right. Mm-hmm. I'm using accessory muscles. I'm doing shoulder elevation. Some people will flare their ribs. But instead, you really want to think about breathing using the diaphragm three-dimensionally, right? Front and back, side to side, and up and down. Most of us breathe really good up and out, but a lot of us have a hard time breathing laterally into our, like I say, sides, and also down. And
I got to admit, I never even thought to try that. I'm fascinated.
Yeah. And I tell people, breathing and diaphragmatic breathing can be a great way to stimulate the vagus nerve to help with, right, getting into parasympathetic rest and digest, right? Good for peristalsis, digestion, good for calmness. And
I want you to explain vagus nerve, because this is the funny thing. I had, again, yet another thing I had never heard of until I was on TikTok. Okay. Because TikTok seems to be the source of all of my random information. But I was fascinated by the vagus nerve. I never had heard of it before.
Yeah. So it's the longest cranial nerve. We've got 12 cranial nerves. It's the longest cranial nerve. So think of it like this. Your vagus nerve travels from your head all the way down and innervates lots of things in your organs. It innervates a lot of the organs as well as your pelvic floor. So you need to have parasympathetic tone or activity so you can go to the bathroom. A lot of people think when you're peeing or pooping, you have to have a strong pelvic floor so you can push your pee out and push your poop out. It's the opposite. You want to have your pelvic floor to relax. The parasympathetic, you have, once you activate the parasympathetic, you have involuntary sphincters that will relax. And as your pelvic floor also relaxes, everything will come out. So you can even see a little bit behind me. I have diagrams of the bladder, and there's a detrusor muscle that will contract subconsciously while these sphincters in your pelvic floor relax. But for a lot of people, the detrusor muscle will contract, but they will have a hard time letting that go. From what? Maybe trauma, maybe surgery, scar tissue. Maybe their kid is banging on their door and they can't relax because they're trying to go, hey, get out of here. Give
Psychological. Yeah.
And so I tell people, you need to get into that parasympathetic so you can have good bowel movements and have, avoid urgency, leaking, empty your bladder, because a lot of people will push their pee out. They'll like rush pee where it's like, shh. And sometimes you just have your bladder is that full where you have to go, but you should just be sitting on the toilet and breathing. And I think that is what my mission is, because most of the things I treat online is constipation, painful penetration, and diastasis and pregnancy things. Those are the biggest things that I treat. And a lot of it is because people don't know how to use diaphragmatic breathing. So I have a whole method. That's why I kind of have a whole method on it, showing you what the diaphragm muscle is, how to do it, and then how to not only implement diaphragmatic breathing to help stimulate that vagus nerve, but also you can use the diaphragm to activate muscles because of where the diaphragm attaches. It's like, imagine, like, remember back in the day, maybe when you were with all your kids in elementary school holding that like rainbow tent in a circle and you guys pulled it tight. Do you know what I'm talking about?
Yeah.
That's like your diaphragm. It is expansive and it attaches to your lumbar vertebrae. It attaches onto your breastbone, and then it attaches down into your 6 lower ribs. So and then muscles attach onto those areas. So when you go, if you even have your hands on your low belly and you kind of go, shh, you can feel that pull in and you can feel those muscles activate. So you can use the diaphragm for lots of issues with, because people always say, ever since I had a kid, I can't get my lower belly to activate. And a lot of women will carry more fat lower, right? The pooch that everybody Yeah,
I
everyone.
definitely have it.
Yeah, everybody tries to get rid of it. Well, I never had this before I had kids, or it used to be more firm. And for some people, there's a genetic component of that's just where you carry more fat, right? Everybody's a little different. But for a lot of my patients, it's because they're using their upper abdominals and not using their lower abdominals. And you see this commonly with women that have had C-sections because why? They cut through all of those layers. They cut through the muscle, they cut through the skin, the fat, the fascia. And when you do that, you can damage, or you can not necessarily damage, but you can affect the nerves. So maybe you have more numbness. I call it a sleepy tummy. So you have the muscle, it's there. I can feel
I
it.
am so fascinated by this right now because we were talking right before we went on air, and I was saying that I was, a personal trainer and everything for so many years. So after my first and second pregnancies, after both, I was able to get that belly nice and flat again. Right now, I used to teach Pilates, and one of the things they spoke about was literally kind of activating each muscle very slowly, very deliberately, all the way down, to the pelvic bone, like every little muscle. And after I had my third child, I was telling you I had sciatica. I was like, I ain't doing that stuff. I'm like,
you're like, I can't.
I was like, no, it took too much effort, which is terrible. I have to get it. And I've been talking about doing stuff like that again. That makes sense. Oh my gosh, I'm having all kinds of brain connections right now.
But I'm glad you brought that up, because that's a big thing that a lot of my patients complain about is that, but after their first pregnancy, they were able to lose the weight. They were able to, regain their strength in their glutes and their stomach. But then after the subsequent 2 or 3, 4 kids, it's like their body just isn't in sync, or it took them maybe instead of 6 months, 1, 2, 3 years. And I think there's this big rush, it's like everything in society, right? You want to look good, you want to feel good, but there's this big push for like bounce back or get your bounce back body. And it's like, your body is always going to change after every pregnancy. And it's like, it's going to be your new body, your new you, but there's no rush, because I think there's this idea that, oh, my doctor cleared me at 6 to 8 weeks, like go ahead and go run. Well, I had a patient who did that, and they didn't do any strengthening. They're like, okay, I'm just going to run, and what happened? They developed prolapse because they didn't have any pelvic floor or abdominal strength. They just went out and did high level, high intensity exercise. And now they have pelvic pain, painful sex, leaking. And in reality, we need these doctors, and we need people to realize, or to advocate for themselves. Hey, you know what? I really want to see a pelvic floor therapist before I get back to weightlifting or Pilates, because like you had sciatica. If you would have maybe seen somebody right away, maybe they could have helped relieve it, and you would have been like, wow, I feel better, so I can work out. Because a lot of people, it's a vicious cycle. Pain is right. You don't feel good. So what do? Don't move, because you feel best when you don't move. But then you start to develop stiffness, weakness, other issues.
You weaken other muscles, and then you wind up having whole other different issues. And I got to say, like, and I feel like we need to speak to so many women out there right now, right? Because we were talking about being a new mother and all these things. We put such a priority on our children, as of course we're bound to do, but it cannot be at the sacrifice of ourselves.
Yes.
Because in the long run, I have to admit, that's why I never really aggressively pursued a solution to my sciatica. I mean, I go to I go to massage therapy here and there, or a chiropractor here and there. But if you're not taking care of yourself, if you're not getting that issue from the very get-go, it could become into a long-term problem that really cascades into a whole lot of other issues.
Yeah. And I truly feel like statistically, women are more likely to have mental health issues like anxiety, depression, and autoimmune diseases like rheumatoid arthritis, fibromyalgia. And I truly feel that a lot of that is because, women are just nurturing in general, and you're taking care of your kids, you're taking care of your partner, and you're not taking that time for yourself, and your body just starts to, develop all of these things because of that. And I truly feel that that's one of the main reasons. And again, the other concept of, I think a lot of women feel like when they go to the doctor, they're not being listened to. When they say, hey, I'm having horrible back pain, or hey, I'm having sciatica, and your doctor says, oh, well, you just had a baby, that's normal. Or like, oh, you're peeing your pants, that's normal, you just had a baby. And I hate that, because is it common? Yes, it's extremely common. Is it normal? It's not normal. And I think that's the problem. We've like normalized, peeing your pants. You probably joke with your friends, like you
No,
laugh
seriously.
and
You just assume that this is, okay, we get to a certain age, this is something that happens, or we just had a kid, it's depends time.
Yeah.
There's no other solution. You gotta, basically that's what you're left with. But I like literally, I had no idea that this was a thing. Like there is some kind of physical therapy that really focuses on that. I'm so excited that you're here.
Yes, I would love to treat you. I think this happens a lot too with women that develop the diastasis recti, or the abdominal separation, because for a lot of doctors, they'll say, oh, well, that happens after kids, or, I mean, you can get a tummy tuck, but it's not covered by insurance because it's cosmetic. And then you have a lot of women feeling very, very trapped because their doctor didn't recommend, pelvic floor physical therapy. And they're just thinking, well, I can't afford a tummy tuck, and I'm scared to have it because it's a major surgery and there's complications that a lot of my patients will develop after. So, versus wait, let's get them to learn how to breathe so they can activate their abdominals. Let's get them in so we can do some manual therapy. Because a lot of times what will happen is basically the diastasis or separation is where the rectus abdominis starts to pull away from the linea alba. It's a connective tissue from your chest bone all the way down to your pubic bone. And usually it will accommodate, or it will stretch to accommodate the growth of the baby. And once the baby is out, it should come back together and heal. But sometimes it doesn't, because maybe you carried twins, triplets. Maybe you put on a little more weight. Maybe you had other kids and you had to do a lot of lifting, or you were still working while you were pregnant and you were putting a lot of intra-abdominal pressure, leaning forward, squatting. There are different reasons why you may have it more than others. But what happens is once it separates, sometimes it just balls up into scar tissue. So when I feel people's stomachs, I'll say, ooh, do you have pain right there? And they're like, yes, that's where it hurts. And I'm like, oh, that just needs to get broken up. So I'll go in and do some of my I do visceral therapy as well as pelvic floor therapy. That's the two things I specialize in. So I'll go in and break it up, whether it's with my hands, with tools, with cups. And what's crazy.
So if you have that kind of separation, because again, I know of women that have had this, the separation of their abdominal muscles because of pregnancy and whatnot, and they didn't do anything for a long period of time. Is there a possibility of regaining any of that without surgery?
Yeah, there is. That's the thing. If I would have seen you in the first year, that would have been better, but it's okay. Because if I see you within the first 3 months, I can do kinesiotaping. I can tape your stomach. I can show you how to wear, maybe you need an abdominal brace. So I'm not a huge fan of, I'm not a big fan of like waist trainers for like trying to get your waist thin, or like corsets. But for some people that have, back issues, surgery, it's indicated by a doctor, wearing a lumbar brace or wearing certain braces, for pregnancy, and some even support the pelvic floor. They can help with recovery, because again, who knows what happened during the people don't realize, like, if you would compare childbirth to like rolling your ankle, or, reaching over your head and dislocating your shoulder, right? It's like, it's a traumatic incident and you have to heal. You need all of these things to help heal. So maybe, not just rest and ice, but there's taping, there's support braces. There's so many different things, positions that you can be in. So again, that's why if you can see a physical therapist right before you can deliver too, they're going to teach you things like perineal massage, right? How to help stretch your perineum muscle so you don't have a tear, right? I'm sure maybe
I had to have an episiotomy.
Oh, you did the
for all three of them. Actually, no, just the first two. The first two.
Yeah. Some people will have something done with their first or maybe their second, but then after that, they're okay. They might not tear. And for some women, they don't know. And sometimes too, it doesn't matter how much you prep. Your baby could just be a big baby. It could be.
I was going to say, my children have giant heads to this day. But no, seriously, with my first son, oh, that was a nightmare. Like if I was to it is amazing how your memory will fade over time. So I am one of 11 children.
Wow.
Yeah. My mom had 11 kids. And it's so funny as you're talking about certain exercises and stuff like that. Like I'm going, oh my God, my mother did that. I remember her doing these things like the breathing and stuff. And now I'm going, now I know why. But I was number 6. The first 5, they knocked her all out. They were all knocked out, because it was up back in the 60s. They were put unconscious and then they woke up and they had a baby. With me, my mom got quote unquote approval for Lamaze. Natural childbirth. My dad was going to be there. They were so excited. And I was named after their Lamaze coach. So of course, when I'm having my first child, I feel this sense of pressure. Yeah. I can't do an epidural. I have to do natural childbirth.
Yeah.
Oh my gosh, what a nightmare. And everything that could go wrong went wrong. It was hard labor because they had to do Pitocin. There was an issue.
They had to
induce 2 weeks late. And I winded up being in hard labor for like 15 hours. And when it was time to push, I was exhausted. 2 hours. And then my son's heart stopped and I couldn't get him out. So they had to rip me open, get him out, and then rushed off. Thank God he was okay, but it was a nightmare. Let me tell you, my second child, I'm like, bring me that epidural. Just bring it to me.
It's funny because I had a patient in a couple of weeks ago and she had, I want to say she had 4 kids. And she was the first patient that had described childbirth as being like Christmas morning. And I said, what do you mean? And she said, it's the best thing ever. When the epidural hits and you get that epidural, she's like, it's great. It's Christmas Day. And then your baby comes out and everything is great. And I was thinking,
my second child was born. My last child actually was born the day before Thanksgiving. So I was watching Martha Stewart on the television in the room. I'm like, okay, let's get birth done. It was so easy. It was fantastic. It was a little angel. I got to appreciate the moment. But I mean, I often say it, and I hate scaring anybody. Like, I think there were some issues that the doctors did not address. And that's why I had so many issues.
Yeah, I know. You really need to be prepared. And it's not, I tell people you can prep all you want, just be prepared for everything going sideways, backwards, upside down, and just have your advocate, whether it's a doula, a midwife, your partner, whoever it is, your mom, whoever's in the room with you, just let them know that, because sometimes like you're so exhausted or you're so, you're unable to kind of advocate for yourself. And it can be, your experience can be traumatic. I have had patients where, they're looking for the big hand nurse or the long armed nurse because they can't figure out why the baby's not coming down. So everybody is literally shoving up there, right? You have multiple nurses, right? What happens? They finally get a doctor in and the doctor like takes one look and says, oh, the head's caught on the pelvis. We need to do a C-section. And she's now had multiple nurses searching up there. And it was a really traumatic experience. And, my patient actually had, suffered from like PTSD from it and a little bit of postpartum depression. So again, everyone's.
And I think that also when you're in that kind of traumatic, and especially, like I said, pushing for a couple of hours, I mean, it was ridiculous. And the episiotomy, that's where like, I wish back 24 years ago, that I had someone that could have recommended me to a pelvic floor physical therapist. I mean, I sat on donuts for 6 months.
Yeah. And they don't, so a lot of doctors won't do episiotomies anymore. For people that don't know what that is. So instead of the perineum just naturally tearing when the baby comes out, they actually do a surgical cut to open this area up. But what happens is, I like to explain it like this. When you open a bag of chips and you're trying to just open the bag of chips just a little bit, but then all of a sudden you put your hand in and now that slit is bigger. Well, you compromise the integrity of the chip bag. It's the same thing here. You've now compromised these tissues and now you're going to add pressure and it's going to cause it usually to tear more. So they usually avoid that.
Yeah, I actually originally, and then the reason they didn't do it immediately was because I said I didn't want it.
Yeah.
I didn't want it. But once his heart stopped, they didn't really have a choice, and they had to go in. But
I have patients still that their doctors say they want to do it. Like basically, especially for moms that are over their due date, they'll go, oh, we're going to induce with Pitocin and then we're going to do an episiotomy. And I'll say, I really recommend against it. And, I educate them on why, but it's, it's your choice. So.
But I again, it goes back to the pelvic health and really looking at that. Cause like I said, I feel like there would be so many different things that, like, scenarios in my life that would have been different if I known about this when I was young.
Yeah.
So
I think sex is a big one too. And like, right, there's a lot of people that don't want to talk about it. I have patients that have been with their partners or their, significant others married for like 10, 20 years. And they've never told them that they were unable to orgasm. They've just been pretending. And I feel bad for them because, how are they supposed to now, bring that up to their partner? And not everybody, only a small percentage of us, like it's less than like 1/3 of people can orgasm with penetration or during intercourse. For a lot of people, they need external stimulation. And that's why like the development of like, cute kind of vibrators where you can slide something on your hand or, just educating people like, wait, slow down, like foreplay. That's so important. Kissing, stimulating the right areas. And then also realizing that sex is not just about the physical aspect, because I get so many women that come to me and they say, there's something wrong with me down there. I can't have sex. It feels like I'm hitting a wall. All my friends can orgasm. I can't. Right. And I look down there and I say, your pelvic floor is beautiful. Everything feels great. Everything looks fantastic. These are what are some things that may be going on. And you find out, oh, the partner was cheating on them with another woman. And now they have insecurities in the relationship. Oh, their partner was telling them that they need to lose weight because they're getting fat. And it's that mental component, because sex is, again, it's not just physical. You need to have that mental, emotional connection with your partner, because that can lead, if not, that can lead to difficulty with orgasm, arousal, painful penetration in sex. Because a lot of women think as they get older, oh, I'm having pain with sex with my partner because I have low estrogen and it's vaginal dryness. And even the doctors will say, oh, it's vaginal dryness. And the patients will come to me and I'm like, your vagina feels great. Like you have a ton of lubrication. It's, your pelvic floor is actually really tight. And maybe they had, or maybe, there's someone that works out all the time and they don't stretch. And so when their partner is trying to get in there, they're so tight like this that it's causing the tissues to tear and bleed. Hence why the doctor thinks it's vaginal dryness. So you really do, even if your doctor does say even if it is really vaginal dryness, or you see your OBGYN or your gynecologist, I still recommend seeing a pelvic floor therapist, because again, it could just be a little bit of, stiffness, who knows? Again, a lot of people hold their breath like when their partner is entering them and instead of breathing, and that can cause everything to tighten up. So there's lots of different, I have a webinar talking about this, but then I have even next to me, like all these tools for painful penetration, like dilators, pelvic wand. So there's lots of different things, because I think a lot of people just think, oh, I'm always going to have this, or you know what, I'm old anyway. Why do I need to have sex? But if you like it and you enjoy it with your partner,
right?
Yeah.
No, I kind of feel like, I do think that there is a certain degree of women in particular that do have these problems, but they don't know that these are their solutions to it. And I think this is such a great conversation. I'm so grateful for it. So from here, if a person wanted, like, okay, you know what, I need to get information on this. Now, of course, we have your social media platform, which is so much, aside from the fact that really informational, but also a lot of fun. You were fantastic on that. You're a joy.
Thank you.
But beyond that, like, where can they get more information? Where can they learn? At the very least, if there is no one around them that they can go to, what they can at least take care of themselves, so to speak.
Yeah. So I tell people, if you're in an area where you don't necessarily have a pelvic floor therapist or access to that, you need to go on the internet and start looking up. There are lots of different medical professionals, gynecologists, pelvic floor PTs out there giving away free information, right? I have free handouts. Even one of my handouts is a PDF with a bunch of hyperlinks. So it has different links to find, let's say you're looking for a urologist. Maybe you're somebody that has fertility issues and you need to see a reproductive specialist. Maybe you're having chronic UTIs and chronic infections, and your doctor keeps treating it with antibiotics, but you actually have interstitial cystitis, commonly misdiagnosed, or, your doctor keeps saying, oh, maybe it's an STD or an STI, and it's not, it's IC. So you need to see a urogynecologist. So I would say what you can do is go online and you can look up people in your area. If you're somebody that needs to use your insurance, a great thing you can do is flip your insurance card over, call the back of it and say, hey, I'm looking for all the pelvic floor therapists in a 50-mile radius, or I'm looking for all of the gynecologists in a 50-mile radius, and kind of go from there, and then put their names online and see if anything pops up, right? Yelp and different and search engines are a good way to kind of look at reviews and see, and then you can kind of go through people's pages. But you're right. It can be
Is there like a website for a board, like board certified or something like that? I mean, board certified is like the wrong word, but
ACOG is a great one for gynecologists. And then there's also APTA is for physical therapy board. And you can just look up APTA pelvic.
Okay. Also, because that's, I think, that where the confusion is. Like, I've heard of obviously I've heard of physical therapy. I've had physical therapy for a lot of different things, but for a specialty like that, that's different. And you really want to find someone that knows what they're talking about and has a specialty in it. I keep on explaining to people, just because someone has an overall training doesn't mean that they specialize in something in particular. And you might need somebody that is a specialist.
Yeah. And a lot of us too, we're constantly taking more continued education, constantly trying to get more certifications. I have been getting a lot of moms online with their kids having urinary issues, incontinence, constipation, because a lot of kids get constipated. And so I'm actually going to be taking a course in the fall for, gastrointestinal disorders and pelvic floor dysfunction from like the age of 1 to 18. So I'm really excited because there are people out there. You're right. It's difficult to find them, but that's one of the reasons why I created that PDF, because that was one of the messages or the emails I was getting all the time. So,
and where can they find that PDF?
If you go onto my link tree, I'll send it to you too. And you click find a medical professional near me, it will take you right to it. And it'll take you to the PDF. It's free. You just
definitely send it to me, because I'll put it in the description. So everybody, if you're interested, it will be in the description so you can go and take a look at it. Yeah. I'm so grateful for you today. This was such a great conversation.
Yeah, we could talk forever, right?
I know. I'm like sitting there like, I could go on, but I know I've used so much of your time, and I'm so grateful though. Thank you so much for coming on today.
No, I appreciate it. I like other people too that are willing to kind of help, especially women, help them out and really spread awareness on this, because again, I think a lot of people are suffering in silence. And I want to, one of the things about my social media is it's weird, it's honest, it's open, because it's truth, right? It's like, this happens to everybody, right? You don't have to like be alone. You don't have to think like, oh, it's only me. It's like, no, it's a lot of people, right? And there's help out there. So I really appreciate you having me on.